Hello everyone, welcome back to my channel. So today I'm going to share my experience with LASIK surgery, or you can say laser eye surgery to correct vision. And I had done this surgery back in 2018, and now this is 2023. That is 5 years. It has been 5 years after the surgery. And I just made this video so that I know many of them who are wearing spectacles or glasses for long years of time just want to get rid of this glasses, and most of them want to try LASIK surgery, and they have no idea how is it, whether it is safe, whether it is effective, whether it is permanent. So I hope after watching this video you will get a clear idea about this eye surgery. And I'm not going to explain a lot about these surgical procedures and medical aspects of that. I'm just going to talk about this LASIK eye surgery based on my experience and how was it for me. So let's get started. LASIK surgery is basically performed to correct your power of vision. So from 8 years onwards, I started wearing spectacles, and it was difficult for me after some period of time in my life. I used to feel like I have to wear glasses or spectacles when I bath because it was not clear for me. Yeah, and I had the issue of myopia, which is nearsightedness. See, objects which are near was clear to me. The objects which are far was not clear to me. It was blurry. So this is my condition, and my power was, I think, right eye was plus 3.5 and my left eye was plus 2.5 approximately. And this was my refractive error. So I wanted to do this surgery 18 years old, or I heard about this surgery, and I had went for consultation. So that time the doctor said that till 21 to 22 years your nerves will be still developing, so the ideal age would be after 22 years. So then I waited, and then I went for this surgery when I was 23 years old. Why I wanted to do LASIK badly was that lack of confidence was one of the reasons. I used to wear headscarf and spectacles, and what everyone could see was maybe 1 or 2 inches of my face and nothing else. And it was quite very uncomfortable. And I really wanted to do this surgery badly. That's it. So I went for it. And this before doing this surgery, you have to meet a lot of criteria. Okay, so I have just listed down. So one thing is that you need a healthy eyes, and your overall health should be good, and the age. So if you're young, if you're about 23 years old, you can go for the surgery, and there's also a limit for the age, and not everyone will be qualified for the surgery because they will conduct a pre-operative examination of our eye. They will measure the cornea thickness, they will measure the uh, they will check everything of the eyes, and also they will check whether the nerves are completely developed or is there any nerve damage. So a lot of pre-operative examination, maybe 3 to 4 tests will be conducted to check whether how good is your eyes and whether the surgery can be performed on you. Now another criteria is that your cornea should have sufficient thickness, and your pupils also must not be large. It should be in the ideal size, and your refractive errors like plus 2.5 plus 3.5 or whatever it means, it should not be very high. And and one important criteria is that you should have a stable vision for at least 1 to 2 years, and basically overall you should be healthy. So these are the criteria for getting a LASIK surgery done. So after my pre-operative eye examination was done, I was qualified. They gave me a brief idea about how is the surgery, what is the aftercare procedure and everything. Now after that, I went for the surgery. A date was fixed. I went. So what they do is basically they give you an anesthetic eye drops, and you are going to feel everything. You can see that entire procedure because it is done on our eyes. So they will keep an eyelid retractor for the entire procedure, and your eye will be open. You cannot even close, even if you wish to close it, and you can really see what is happening. So it was really interesting to see all that. So they will mark your corneal surface on where the cut should be performed, and you can really feel the marking, the incision, and how they're moving the corneal flap. Everything you can feel, and it's nothing to be scared of because you will have that anesthetic effect on your, and there is not much pain. So if you're having a very large eyes, this will be useful. For me, one of my eyes was a little bit small, and the eyelid retractor was really painful for me. But if your eyes are large enough, it's fine, and it's not that painful. It's all bearable. And once after marking and the incision is open, you can see the glare. So you will see red glares of light, green glares of light, and the doctors constantly, they will ask how do we feel and can we see the light and everything. So you don't need to worry about that surgery. So it was fine surgery. So after the surgery, what I found is red markings. Like I could see a red marking below my white area, the cornea, and those markings there. So usually that happens when eyelid retractors are placed, and minor, I can say it's a minor injury, and that gets recovered within 3 to 4 days, and they will give you eye drops. These eye drops are basically tear drops. So this has to be continuously used for 6 months. So the recovery period after the surgery was 1 week for me. After 1 week, I was fine, and that pink abrasions were resolving, and I could see things clearly. What made me so happy is that after the surgery, I could see things clearly, especially those things which was very far. So I was in a stage where while bathing, I have to wear specs, and without specs, I couldn't do anything. So I was in that stage. After that stage, it's like getting your vision back. So for that, I was ready to do anything. And was it worth? Yes, it was worth it. And make sure when you do such surgeries, consult a good doctor. A laser or LASIK surgeon should be very good, and a very good hospital settings. This will be really helpful for you. Now the results are quite permanent. 10 to 12 percentage people, when they become the age of 30 or 40, they will be requiring a reading glass. Complications is that basically you will have dry eye syndrome. So this is a condition where the production of tears will be less, and due to this you will have itchy eyes. So this can be prevented by regularly using eye drops, that is eye lubricant drops. And once you start using this, you will not have any itchiness, and this condition is quite temporary and seasonal. So during dry climates, you might get itchy eyes. So after the surgery, within 1 or 2 years, I started getting itchy eyes based on climate change, as I said. So that time I used to use lubricant. So initially they will instruct you to use for 6 months after surgery. After that, you can use based on your convenience. So some people, they also get conjunctivitis, and dry eye syndrome will be there, that is for sure. And it's manageable. It's not going to it's not going to be difficult or hinder your responsibilities for that day, nothing like that. It's just a mild itchiness. So once you use lubricant eye drops, it will be fine. So for 6 months, I didn't use any eye makeup or kajal or kohl pencils for 6 months after the surgery. So once my eyes was back to normal, after 6 months of using continuous eye drops, then I started slowly wearing eye makeup, which was fine. So now I don't have any much issues, and it's perfectly okay. For me, the surgery went very well. Now in future, maybe we don't know, maybe due to age related changes, we might maybe need an enhancement surgery, or maybe we need a reading glasses. That is all due to age related changes. So that's all. And the second important thing is that whenever we buy an eye drop, you have to use it once it's opened. It is only valid for 1 month. And whenever we use these eye drops, make sure you don't touch the tip of the eye drop onto your eyes. It will get contaminated. So make sure there is a sufficient distance for the drop to fall into your eye. And then if you're trying to use contact lenses, make sure just check for the expiry date. If it is for 1 day use, please use it only for 1 day and then discard it. So these are some things you have to take care. And hygiene is very important. Always make sure if you're doing something on your eyes, let it be eye makeup or using an eye drop, your hands should be clean to prevent contamination, infection. It's very important to have a very healthy diet to maintain a good eye health. So please incorporate food rich in omega-3 fatty acids, which is usually found in fatty fish. And if you're vegan, you can try having these supplements. And vitamin C, vitamin A, vitamin E, all are important for your eyes. So you can have all that orange colored vegetables which are rich in beta carotene. You can have orange fruits. These are also rich in beta carotene. Vitamin C rich fruits, orange, tangerines, lemon, amla, everything is good for your eyes. So make sure you include these food in your diet to have a better eye health. Having zinc, sufficient amount of zinc is very useful. So zinc is always associated with reducing age-related macular degenerations of the eye. So having zinc rich food is also important. Again, zinc is also coming from animal sources like organ meat, shellfish, but it's also there present in some legumes and seeds. Have a good amount of water every day to prevent dehydration. So these are some tips for good eye health, and that's all. You're fine. And for me, LASIK surgery was safe, and the only thing which I suffered was dry eye syndrome for a short period of time. And whenever you feel itchiness and this condition, you can a lubricant will help you. So that's my entire experience about LASIK eye surgery, and I hope this video was useful for people who wish to have this surgery or who are worried about the results of the surgery, whether it's going to work, whether it is temporary or permanent. They might get an idea, or they might reached in a conclusion of whether they need it or not. So that's all. I hope this video was informative. Have a nice day and share this video with your friends. Subscribe, like, and comment.